Hi, Assalamualaikum warahmatullahi wabarakatuh. So my name is Firzanatul, AKMAL binti Hashim. You guys can call me Firza. So for this reflection video, I will make as follow by week. Okay, first for the first week is icebreaking. Icebreaking, we are knowing new friend. It's like we are approaching a new friend that's from different batch. I got to know from pharmacy, MBBS year 1, year 2. So from there, we are having impression and break the ice between each other. So from there, yeah, we got to know each other. Okay, so for week 2 is okay. Week 2 is the week that we are playing the first game. The first game is passing the drawing from front to back. So it's really we are passing information, and the last one need to draw. So by that, the communication is need in that game because what we hear from the first place is different with what we are producing. Okay, so that week is effective communication skills. So we need to have an understandable communication between each other, mainly in healthcare. Okay, if we are passing a wrong information, we got the wrong medication for the patient. So yeah, effective communication will lead the effective management and also the treatment. Okay, for the second game is a charade. It also a communication skills, effective communication skills, because one person need to identify what our peers are giving information without a verbal yes. As example, if you get a patient that cannot describe anything, they just feel pain. So by that, we need to identify, we need to analyze, we need to examine and also assess why, how, and where the pain is come from. Okay, so we move to the week 3. That is my week. That okay, for my group, we are having a poison ball charade. So basically, when the music stop, the ball, the person who get the ball need to act the answer, and the colleague or the peers need to identify and need to understand what the person are telling you. Okay, the thing about that game is we need to do a quick decision making within the time given. For this week is communication tools. That is okay, for my group we are doing a poison ball charade, and also the other group is hangman, but it's a game that we need to identify the role and also what is the position. So for this week is mainly we need to know how to use a gesture sign, and also we need to improve our understanding what the gesture means. Okay, same as like the week 2 have done, but this one is more to verbal and non-verbal because it's communication tools. Yeah, we move to week 4. That is communication barrier. By this, for the first game, we need to draw something related to the words that have been given. Okay, so for the connecting drawing, how we can relate it to the interprofessional communication skills is because it's a communication barrier. So if we draw or write something wrong, so we cannot understand, and also we will do something that are not right. Yes. Okay. That is for the first game. For the second game is bingo. So by that one is we need to guess, describe the random words, and then we need to do the sign. Okay, sign language for suture, talking, and also there's a 9 gesture that we have learned and need to recognize. So by that, if we in as example, if we in OT room or operation room, OTS, operation theater room, we cannot talk a lot, so we need to use a sign gesture. Okay, so for the last week is from group that make a game such as Among Us healthcare edition. So by that we need to know who is the liar. Okay, most of them was a healthcare worker, but one is patient. So we need to identify who is the patient. Mainly is a culprit. So basically for that week is okay, for the 5th week is decision making skills. So if we are giving a wrong decision, such as we need to think first before we give the exact decision, the exact treatment, the medication, is it true for this and this, like that. So decision making for this week is we need to have a better solution for practice, for this medical practice. So yeah, that's all for my reflection from week 1 to week 5. Okay, thank you everyone. Assalamualaikum.